cases, new reported cases. 2 days ago we had 257, which was our record, and then today we had 285. So basically where we are with new cases is this is on pace to be by far the largest week of both sheer number of new cases and unfortunately the biggest jump that we've seen in a long time in new cases. Since Sunday, we've reported 22 deaths. I don't know if I hope it won't be the deadliest week, but we're on pace to be the deadliest or right at that. And so that is going to segue into some things that we're going to talk about how to keep safe in the midst of what may be coming. But I do have some good news to share. So we reached a deal with the feds so that we're going to have an additional 1,000 tests a day. So, you know, we've got 500 tests at the AEC, we got 500 tests at Ellis Davis Fieldhouse, and those are drive-through tests, but we're going to have an additional 1,000. Now, those aren't going to be just more cars at those two places. We're going to take those out into the community. So we're going to be going to some congregate settings, halfway houses, homeless encampments, things, maybe some nursing homes that aren't getting the testing that they need. We're going to be doing that. We're going to announce 2 walk-up test sites in South Dallas. We don't have the details completely worked out, so we'll do that tomorrow. And so there's a group called the Parkland Center for Clinical Innovation. The Parkland Center for Clinical Innovation are data experts, and they'll take all the hospital data, the data from all sorts of areas, and they'll find those places where communities that have high on insurance most need these mobile test sites. We'll be getting those out. Of course, we'll be listening to our community partners. That doesn't just include people in government, but we'll be listening to all of you on that. We won't be able to get everybody a local test site, you know, at your particular place of business or house of worship, but we will hopefully be able to get those into just about every neighborhood. And so that is for this month. The deal is for through the end of this month. And we'll have more information on that as we go forward. I've got with me a hand sanitizer from the Dallas Mavericks. And I've got with me, I think I was wearing it a minute ago, a mask from the Dallas Mavericks. And the Mavericks have partnered with me to get hand sanitizer and mask to our protesters. You know, I got to tell you, as a parent and just as an American, I really appreciate the spirit of these peaceful protesters. And it's not lost on me as I'm up here talking to you about the dangers of COVID, the risk that a lot of them are taking. And so if you're out there as a protester and you don't have a mask, you can approach, if you're in Dallas, we've given some to the Dallas Police Department. We've given some to Mothers Against Police Brutality. They'll be in the march and you can get it from them. And then we're giving some to Change for Dallas, another group that is active in the protest. If your group or your church is active in the protest and you feel that you want to hand out some of these masks, you can contact my office and we'll work with you to get those out. Because there's 4 things that we do to keep safe, right? And it's almost probably ad nauseum to everyone. You've heard us say it so much. It's avoiding large crowds, which you can't do if you're at a protest. And I know many of you have found great ways to have your voices heard effectively through social media. And if that's what you're doing, keep doing it because it's working. It's excellent. You know, we don't want to jump on people's announcements. I don't know what's been announced yet today, but there are some moves towards some of the suggestions and demands that we got in our Facebook Live meeting last Saturday night. I had a meeting. I invited the city manager, the police chief for the city of Dallas, that is, and others, and John Crusoe from the government side, but those came. And then also I invited clergy and civil rights leaders and community organizers. That we talked for a couple hours. It was a tense discussion. They sent us a list of demands. Some of those things people are, all those things, people are taking to heart. They're looking at them carefully. We're going to keep that conversation going. So if your way of communicating in this, unprecedented time for our country is through social media, keep doing it that way. It's working. If your way of communicating is through these protests, I want you to know, just as an American peaceful protesters, I'm talking a lot, I know a lot of you are young. I am proud of what you're doing. I think what you're doing is an important thing. And again, if you can find a way to do it outside of a large crowd because of COVID, and because we know that COVID is disproportionately affecting communities of color, please find a way to do it. If you cannot, we want to help you do it safely, all right? And so we've got companies that are going to be providing hand sanitizer and masks. So if you don't have it, you will now. And then these protests are outside, and so we're going to give you the space that you need to be 6 feet apart. Please, if while you're out protesting, if you can please stay 6 feet apart. We know, and doctors are going to talk about that more in this news conference, but what we know is that that is a key component of keeping you safe. And hey, I know you're young, and sometimes when we're young, because 100 years ago I was young, and when I was young I thought I was invincible, okay? But you're not invincible, okay? We've had a young lady, we've had more than one, succumb to and die from this virus. But even if you think you're invincible, by the way, I realize you're probably not watching this news conference, but maybe your mama is. So mom, tell them, if they think they're invincible, please do these things. Please stay 6 feet apart. Please don't bring home something that Nana and maybe your parents can't handle. So help us keep keep the protesters, keep your young people safe by asking them to do that thing. Another thing is, I want you to use these hand sanitizers. Don't save them. We'll get you some more, okay? But I want you to use those a lot while you're out there. There's a lot of high-touch things out there, okay? And so if I'm asymptomatic COVID, but I don't know it, and I'm out there protesting, and Jobin is coming up behind me, and he touches on something, and it touches his eye, then he can get sick, okay? So please use that a lot while you're out there. I've asked our police today to get tested. We're going to get them all tested because they've all been in a large gathering, so we want to make that available to them. But I want to make testing available to you, protesters, and mamas and loved ones. Please let every protester know this. You can go to if you have a car, okay, you can go to the AAC site, you can go to the Ellis Davis site. We don't take walk-ups at those two sites yet. You can get somebody to give you a ride there. You can get a test, right? It's a little bit of a turnaround on these tests. You're going to have to wait a few days to get it, but you'll know your status, and you'll know whether you're sick, and that's really going to be important to help us stem the curve of the uptick that's pretty significant that we're beginning to see now. Okay, so help us keep you safe and your loved ones safe and your family safe. Now, we're going to announce tomorrow 2 walk-up sites in South Dallas, okay? A walk-up site, so if you don't have a car, but you're going to take public transportation, what have you, then that may be the site for you. We're going to look at ways to bring that testing to you where you are. But I need you to do your part. And I want to make this clear, too. This is Parkland will be doing the testing. We're not sharing your information with law enforcement, okay? This will be a confidential test. If you have a mixed status, in other words, you not mixed status family, or you don't have all the papers, don't worry about that. This doesn't go against the public charge rule, okay? And we're not going to be telling anybody who you are other than the doctors that need to know, and then you get your test result back. And if you're sick, you'll be hearing from us. We'll want to know who your contacts are, these sort of things. But it's really going to be important to help you and your family that you do that. Trust me, the information will not be shared with. If you got a warrant, I don't care. I just want to get you tested, okay? I mean, I'm not saying I don't care. You need to take care of your warrant, but this is not a law enforcement thing. This is a health thing, okay? So very, very, very important. We're gonna hear from Dr. Huang, who's gonna give us an update on some of the numbers, and then we're gonna hear from some doctors on ways to stay safe. One last thing I want to say, and this, what I've done, and I know others have done when we've been out there. I went out the other night when things got pretty heated, the night of the bridge thing, and so I was out there at a distance. I was 6 foot distance, probably more than that. I was, probably 40-foot distance from everybody. And but when I got home, and I want you to do this too, I stripped off my clothes right there at the door, and then the first thing I did is I went and I took a shower, okay? So when you're going home, let's get you all cleaned up, particularly if you live with people that are high risk. Let's get you all cleaned up right as you go in the door. That's another thing that is really important that you can do. So I'm going to turn it over now to Dr. Phil Huang to speak and introduce the others.
Good afternoon. As the judge mentioned, we're reporting 285 new cases today. This brings our total case count in Dallas County now to 11,243. Also reported one new death, and a man in his 60s, resident of city of DeSoto, had been critically ill in an area hospital and had some underlying health risk conditions, and brings our total deaths now in Dallas County to 250. We also reporting in the county jail numbers, 399 inmates now confirmed positive associated with the county jail. 33 jail employees have tested positive. We've got TDCJ now reporting 34 COVID-19 active cases among current inmates and 28 in employees at the Hutchins State Jail. 23 inmates are listed as recovered at Hutchins State Jail. We've also had 2 COVID-related deaths reported among inmates at Hutchins State Jail. And then 4 TDCJ officers from the Beto unit in Anderson County reported to be Dallas County residents and COVID-19 positive. With our homeless shelter situation, 47 residents at Dallas Life tested positive, and 1 resident and 1 staff member at Gateway Family tested positive. Now we've got 39 nursing homes. We're going to go through all of them? No, yeah, we don't need, okay. So again, now our numbers are up to 39 nursing homes with positive residents and staff. So those numbers have been certainly increasing. And that's one of the things to keep in mind in terms of our interpretation. Today is the record number of tests that we're positive tests that we're reporting in this one day. But the testing numbers and the number of positives is dependent on how much testing and things that are going on, and we've said that all along. And one of the things we are seeing, there's been a real concerted effort by the state, by us, by some of the firefighters in our community to get all of the nursing homes tested. And so we are thinking that some of these increases in the numbers are related to some of that testing. So I do want to show, we've talked about what color risk category we're in right now, and we are still in the red category, stay home, stay safe. And I'll show you the monitoring, the indicators that we are monitoring to show, to determine when we can move to orange, because we all really want to move down to orange. We're looking for 14-day steady trend and improvement in these numbers. This is the suspected emergency department visits in the last 24 hours. And then that yellow line's a 7-day average trailing for each day. You can see it's been pretty flat, which is, it hasn't gone down. Oh, you can see the number, it's pretty flat, but it hasn't seen certainly any 14-day decrease, but it hasn't seen a big increase. And actually, I mean, we're somewhat positive or encouraged by that in the sense that with all the things that have been opening up, and we've been talking to our modelers and others, that it indicates that, there's still a lot of people that are practicing the physical distancing, that are wearing the cloth facial coverings, that are washing their hands and doing all these prevention things, so that we're not seeing a big increase as things are opening up. So that's good. Next slide is total number of available ICU beds. Now that number is starting to go down a little, which is we don't want that. We want there to be more available ICU beds. So we're certainly monitoring that because that's part of our hospital capacity. Next slide. This is the general hospital admissions for COVID-19 suspected patients. Again, that's been pretty level for the last couple weeks, fluctuates up and down. But the positive part about that is that we're not seeing a big exponential rise or anything with the opening up of some of the businesses, but we're not seeing the decline. Same with the ICU admissions in the last 24 hours, pretty flat. Next slide. This is just general hospitalizations, the hospital census for the hospitals. Slight decrease, but it's sort of, again, flat, plateaued. And then for ICU hospitalizations, again, sort of up and down, a little flat, but not seeing a big rise, not seeing a big fall. I think this is actual numbers of deaths. These are actually by the date of death as opposed to the dates that we report them each day. We report them as soon as we receive the confirmation, but this is going back, and depending on, sometimes there's a delay from the actual date of death. This is the numbers by date of death. Unfortunately, there is that delay in getting these reports, so the last week to 10 days, you have to take with a grain of salt because we continue to get those reports in. But again, those are still, because of that delay in reporting, still considered flat. So overall, we're considering to see sustained daily census around 300 COVID-19 patients in Dallas County hospitals over the past week. We're seeing sustained number of individuals presenting to Dallas County hospital emergency rooms with suspected COVID-19 symptoms, and about 21% of emergency department visits in Dallas County for 24-hour period ending Tuesday, June 2nd, represented about 397 patients presented to Dallas County emergency rooms with COVID-19. Just last slide, I think we're just going to show the geographic distribution. Again, our latest zip code slide. Now some of the hotspots, 75211, 75061, continue to see sort of pretty high levels, 75217, 75270. So I think that's it for me, and I'll turn it over now to Judge.
One other thing that I didn't mention, guys, is, sorry, I'll just keep this on, it's so brief. One other thing I didn't mention is that we got $10 million approved for more tracing, and so we will be adding 260-ish tracers, to disease detectives, if you will, so that when we find someone with COVID, they'll be on the phone finding out who your close contacts were. A close contact, by the way, is someone that you were around, if you're sick, someone that you're around 48 hours before your symptoms to currently, for within 6 feet for more than 15 minutes. And so we try to find those, and we need more people as we have more illnesses, so we're going to keep up with that. So Dr. Mark Casanova is the president this year of the Dallas County Medical Society. He's also been a tremendous advisor to me and to all of us on this COVID outbreak. And he serves also on the public health committee of our Economic Recovery Task Force that came up with, along with Dr. Wong and others, this color-coded chart and many other things. He's brought with him Dr. Lisa Taylor Kennedy, who's a renowned anesthesiologist here in town, and I believe they're both parents, and they want to talk to you in their capacity as doctors and parents. So please come up and talk to us.
Good afternoon. Thank Judge Jenkins for inviting us to participate in this news broadcast, such that we can serve our purpose as healthcare providers and professionals to the general public. Our job is not to judge. It is not to decide whether protesting is appropriate or to discount any of the actions that led up to the protest currently. It is our job simply to provide the proper guidance, the medical guidance, to our communities. I can't breathe. Those agonizing words of George Floyd is why we're here. And I understand I have 2 children, 2 millennials, that feel that they need to be out there protesting. We want you to do it safely. We want you to wear facial coverings. Always wear a mask, and preferably a light-colored mask. We want you to wear clothing that is loose-fitting. We want you to hydrate. We want you to remember that we are currently in a COVID-19 pandemic. It is still here. Don't forget where we are. Keep yourself safe. Keep those that you care about safe. If you are in a high-risk group, stay at home. If you are a caregiver to someone in a high-risk group, stay at home. When you're out, use the same kind of sense of thought that you use when you're going to the grocery store, to work, or to any other important errands that you may run. Violence is counterproductive to health. It just is. All types of violence, whether that be physical violence, emotional violence, or mental violence. We have to understand that any act of violence discounts any good things that have come from any social gathering or demonstrating. Keep yourself safe. Keep those you care about safe. Keep your community safe. Thank you for having me this afternoon. And here's Dr. Mark Casanova.
Thank you, Dr. Taylor Kennedy, for sharing that with us. In addition to those words of "I can't breathe," we want to ensure that individuals who are gathering together in demonstration and protest, to ensure that you can breathe. And what we mean by that is ensure that the facial covering you're wearing is loose-fitting. Use breathable material. Remember, when we are projecting our voice together for a cause, the possibility of transmitting virus, projecting those viral particles even further than normal is certainly present. So ensure that you're wearing a safe mask, but one that is not so occlusive, that gets so hot that you're then forced to use it like this when you're talking and just breathing in the Texas summer. Ensure, and Judge spoke to this, that we keep the distance as we come together. As we join in unity, ensure that you're keeping the physical distance. I commend the leaders in Dallas County and the city of Dallas and other cities that are finding appropriate physical places for individuals to gather in demonstration and raising their voice for better causes in a better world that we can hopefully engage in. The judge alluded to this as well. Keep it clean, okay? What do we mean by that? Hand sanitizer on you at all times, washing those hands, hitting the door at the end of the day, at the curfew time, taking off those clothes, beelining it for the shower, washing those hands and the face. Protective, safe protesting. Judge Jenkins mentioned there's a lot of high-touch surfaces. We see folks use microphones, use bullhorns in demonstration, in talking to one another, in hearing their voice. Use a coffee filter. Use it as a microphone boundary, if you will. Remove it when you've used it, pass it to the next individual for a fresh coffee filter. So practice safe protesting, the way we practice other safe acts. And lastly, stay safe, okay? When we see scenes of individuals embarking upon roadways, upon highways, it's simply not safe. It's not safe for you. It's not safe for others. The last thing that we want as physicians is to provide counsel to a family member, to a parent, to somebody's mom, to say, listen, we're so sorry, but we can't help your young individual, your son, your daughter breathe. They're on a breathing machine now because of a trauma, but we're unable to help them. So keep those factors in mind. Stay safe, stay engaged, keep the physical distance, use those loose-fitting face masks, and keep clean. Lastly, be safe, and may God bless all of us.
We'll take any questions if anybody has them.
Judge, if I may,
Sure.
you know, we're on pace, we could be on pace for one of the deadliest weeks in Dallas County. Is there a threshold there a number that forces any action that says, if we get to this level, all right, we need to take some action? Is there anything like that?
Are you mic'd?
What's it?
Are you mic'd?
No, I'm not.
Okay, so the question was, is there any threshold, given the increase in deaths and cases, that will mean that we need to take an action? So what the governor has said is that he alone will make decisions on whether he will slow down the speed in which things are reopening. You know, we do have some local control. For instance, on where you protest, we're trying to make sure that you are safe where you are, both safe from violence and safe from COVID. Yes, there is something that we all can do, but it's not something that the judge or the mayor or Dr. Wong can do. We can download from dallascountycovid.org that color-coded chart, and we can follow that. And so once again, let me talk to the mothers, because we know who makes the decisions in the house, right? Please download the chart, and when your kids say, we want to go play a full contact sport, see if that's advisable. It's not under red. If dad has diabetes and he says, I want to go hang out at a restaurant or a bar, for that matter, if he doesn't have diabetes right now and he wants to go hang out at a restaurant or a bar, tell him he's going to need to wait a while. And so look at that and use that to keep yourself safe. That's not what I say. That's what these doctors who have prepared their entire adult life for this moment, who are in these specialties of infectious disease, epidemiology, and public health, are telling you to do. It's the same thing the CDC is telling you to do. What else? Anything else?
If I may ask, Judge, I know Dr. Wong had mentioned this, but is there anything your tracing detectives have determined that happened a week ago, maybe even 2 weeks ago, that gets us to 285 cases today? You know, we had bars opening up. We had a younger generation go to these bars, go to restaurants. Anything like that that tells you this is why cases are up?
Sure. I don't think that Phil has that data. Do you have that?
Well, I mean, we are thinking that, again, the numbers, because the number of new cases are very much on the testing, and there really has been a lot of this very concentrated testing on the nursing homes, and so it's testing everyone in these nursing homes. What we've been concerned about and what we've seen in some of these, you know, there's a lot of asymptomatic positives. And so when we're testing everyone, some of those are coming out. And so we do think that that's probably a cause for some of these latest numbers, because there's been a full all-out push to get every nursing home tested for every patient, every staff member. There's been work from the governors, from the firefighters, we've been working with Parkland doing the same thing. So that is, I think, part of what we're going. And that's why we're not monitoring just the number of new positives, because we know as you start testing, if you do more tests, if you just do some things in targeted places, you can get these fluctuations in the numbers. But again, we're watching those other trends, and there's not as magic number that if we hit this, that we go, but we're really looking for those trends that if we all saw 14 days of decline in the number of new admissions, ICU visits, we would all feel good about that and say, hey, we're all going in the right direction. This is very good news. We'd feel comfortable moving into that orange.
Hey, Judge, last question, I'm sorry. Have you had any conversation with your local police department's Chief Renee Hall about how enforcement works when you're trying to keep protesters safely distant from each other, maintaining that safe distance and still allowing them to sort of,
So the question is, if I had conversations with Chief Hall and others in law enforcement about safe distancing, testing, et cetera. Yes, we talk regularly. I talked to TC Broadnecks at 7:45 this morning for 45 minutes. I talked to Renee Hall, our Chief Hall, for probably 35 minutes from 10 to 10:35. I talked to the people in charge of testing for the city about getting all of their officers tested for about 15, 20 minutes today. So we're constantly in communication, on that. And let me say this too, I'm concerned about the officers. When I see 100 people shoulder to shoulder in a deal where we have COVID, which you have no immunity for, and it's spreading through our community, that's a concern. So I do want to get them tested as well. So we are in communication with each other, but most importantly, we want to hear from you. We want to keep those communications going with the community. As I've said, I don't learn from talking, I learn from listening. And believe me, we are listening to you. And, you know, we want to build a more perfect union, and we want to have a situation where not every 10-year-old child who is a child of color has to have a talk with their parents about how to survive a police interaction. We've just got to use this crisis to radically transform the way we do policing and to radically transform the way that we see and respect one another. Thank you. No, here it is, here it is.
Do we want to get a shot of this, Judge?